Hi everybody, this is Dr. Chris Hoff, the Radical Therapist podcast and YouTube channel. Just doing a quick video here on something I'm very interested in talking about. One of my overriding interests these days is in the construct of way of being in counseling and psychotherapy. Some of you might remember way of being from Carl Rogers. But I think most professionals will now agree, and the research supports, that the therapeutic alliance underlines all change occurring in counseling and therapy, and the alliance is greatly affected by therapist skill. And so something I've been having conversations about is how do we teach new counselors and therapists the art of the therapeutic alliance, or can we teach it? But I'm not sure, but I'm going to start trying and doing a series of videos on some things that I found helpful, some things that I use in practice, some things I continue to go back to when I'm feeling a little stuck or what have you. So this is the first in a series of videos I plan to do where I will take on the project of how we might teach the art of the therapeutic alliance or relationship, what have you. And so in this first video, I want to start by sharing a book or a book chapter I found very helpful in my own development. And this chapter is titled Relational Attunement, Internal and External Harmonizing with Clients, and it's by Craig Smith, and it can be found in a book called The Collaborative Practice of Psychology and Therapy. And it's a great chapter overall, but there's a particular part in the chapter that I really like where he references the 4 ways of knowing. And he talks about attending a lecture by Tom Anderson, and some of you might know Tom Anderson of Reflecting Teams fame. But he references attending a talk by Tom Anderson where he gave a talk on the 4 ways of knowing. And these 4 ways of knowing are rational knowing, technical knowing, relational knowing, and bodily knowing. And rational knowing is what most grad students or students in general will know as theories of personality or theories of healthy systemic functioning, those kinds of things, these kinds of overriding theories that drive our technical knowing, which is techniques and interventions derived from these theories. And then the other 2 kind of more marginalized ways of knowing are relational knowing. And this is this idea of how to be with this person at this time in this context. And bodily knowing, and this is some sense in your body that something is significant happening. And I try to, how I tell people about this, and I'm sure we've all been, and those of you who've done group therapy or have been in groups or maybe even 12-step groups or something like that, when you notice somebody saying or going to a very honest or vulnerable place, I don't know if you've been in a room of people, when that happens, all of a sudden you notice the room gets very, very quiet and everybody doesn't know what's going to happen, but they know something's going to important is happening here. And it's almost like this bodily sense that something important is happening. And the relational knowing piece is a good kind of example of this, and Craig Smith talks about it in the chapters, is like how might you meet a friend that comes over that might be in a difficult place, or when a friend comes over in whatever place they might be in, we all kind of have this relational understanding of where they might be in this particular moment or in this particular context, and what they might need in that particular moment or in that particular context. It's this sense of like, oh, this friend seems to be, you could take a look at them, and I have friends like this in my life where they know that I might be struggling a little bit, or I'm chewing on something, or I'm just stuck on something, that kind of thing. And they'll begin to sit with me, slow the conversation down, and begin to ask me about that. And that's kind of this sense of relational knowing, right? So all these ways of knowing are important, but Tom Anderson would make the argument that the rational and technical ways of knowing are the ones that get privileged in our field. And those of you, anybody that's been through grad school, knows that that's the primary focus. They're not really teaching us about bodily knowing or relational knowing or even relational practices a bit, but most of our focus in our educations are on the rational knowing, the larger theories, and then of course the technical knowing, the interventions, etc. that we might do. So so much of what determines what, and this is so dominant, I guess Tom Anderson would say this is so dominant, that so much of what determines what we would see or notice, even in our more relational and bodily ways of being, is determined by our rational and technical thinking, which is unfortunate. So it kind of even hijacks our relational and our bodily ways of knowing, these dominant ways of looking at it. So Tom Anderson would undo this dilemma, or attempt to undo this dilemma, by privileging relational and bodily ways of being while in session, and then after sessions reflect on the technical or the rational ways of knowing after the session. So during sessions, Tom Anderson suggested that we really just kind of bring forward our relational and our bodily ways of being, and just backgrounding the technical and the rational ways of understanding things, and really being with our clients in the moment, in this place, in this time, and in this context. So in an effort to support and strengthen the therapeutic alliance, I too began to practice holding the rational and technical ways of knowing lightly, while bringing forward the more relational ways, and actually trying to teach myself some more relational ways of being, reading about more relational ways of being, and of course paying attention in more mindful ways to my body, what might be going on in this moment, what am I noticing here, that kind of thing. And this has had a tremendous effect on me as a supervisor, instructor, and of course as a clinician. So in Smith's chapter, he offers us a couple of questions for reflection when we're considering what might be called for as we are meeting those with who seek our help. So here's a couple of questions that might prompt you to begin to bring forward the more relational bodily ways of being, as suggested by Craig Smith. And this is, what is it I'm sensing right now? Should I remain quiet or find a way to talk about my inner reactions? That's a great question. What seems most important to the client right now? What would they like me to do? And I'm sure you could think of other questions, or maybe the challenge is to begin to think of other questions that may situate you in a more relational way of knowing, or a more bodily way of knowing, and maybe keep you focused on the relational. The bodily, I think, more is about what has helped me with that is obviously a meditation practice, trying to be more mindful, paying attention to what's going on, and it's just been really helpful. So this is a beginning way. I wanted to kind of make visible the 4 ways of knowing, because some people, I think, don't even know that that's happening, that they're being, that rational or technical ways of knowledge are being privileged in all sessions, and what that might be doing to the therapeutic alliance. Because I guarantee you, and I think the research abundantly now is clear, that the more we can be relational, the more we can be present with our clients where they're at, the more effective we are going to be as clinicians, the stronger the therapeutic alliance will be, and hopefully the more successful the work will be. So I'm going to be doing some more of this stuff, talking about like some of these things that I'm finding helpful, among other topics as well, of course. But I wanted to talk a little more about what has supported me clinically in my practice, and that kind of thing. So hopefully you found this helpful. 4 ways of knowing. Think about it. Which ways of knowing are getting privileged in your practice, and maybe which ones need to be brought more forward. Think about some questions that might help you do that, situate you in that way, and hopefully you found this helpful. My name is Dr. Chris Hoff from the Radical Therapist podcast and YouTube channel. Please find us on social media, and please check out the podcast and the YouTube channel. Thanks for watching.